Thank you everyone for joining our event here tonight. And thank you for taking the time to listen to my talk. I am sick of limits. We have limited access to quality education. We have limited access to great paying jobs. We even have limited access of entities willing to pay into Detroit as a city. The residents here are basically a- accustomed to living according to limits. When I think of community, I like to think of more positive attributes like unity and togetherness and resources and thriving. Unfortunately, being a citizen here in Detroit, I constantly move back to the thought of limits. Most of the issues here revolve around the scarcity of income, which points us to an even greater pandemic here in Detroit: systemic racism. Systemic racism is the primary cause for the lack of resources and services available to the citizens who live here in Detroit. Many businesses and organizations are structured in such a way, or they enforce policies that constantly leave Detroiters at a disadvantage. And public health, to be specific, suffers tremendously. And I can speak to that point in two different ways. Today, I'm going to speak to that from the perspective of mental health and from the perspective of caring for aging adults. My mother suffered from mental illness, and I have been in countless environments, in emergency rooms for hours, in psychiatric office, in the office waiting for the therapist. I've been with other loved ones who've experienced mental health crisis, and it's as if you're pushed along just to go to the next checkpoint. The services that we are provided, they don't fully support us. They don't support us unto to our unique needs. Growing up in the Detroit community, we have like a double disadvantage because we're bound by the restrictions here in our community. My mom, a couple of years ago, also suffered a stroke. So not only was she mentally impaired, she also became physically impaired. I was at a loss. At a young age, I'm looking for a nursing home for my mother. I had no idea where to begin. I'm grateful for my family, who we worked together as a team and as a unit to get the services and the resources that we knew she needed. But the care that she received in the first nursing home was deplorable. That was systematic racism at the highest form. I felt like because we have limited income, or because our zip code is a Detroit address, that we were only supposed to be able to accept limited resources and services. And people in the Detroit area tend to take on this attitude that this is just the way things are, and we accept it. One day I walked in a nursing home, and the members there carried on as if they were on their leisure time. My aunt walked in one day and found her soiled. Her person was soiled, her bedding was soiled, and she was livid, and she walked through the facility to find someone to address our needs. Is this system telling us that because we live in a disadvantaged community, that our value is less than? I leave you with this quote: if you think you're too small to have an impact, try going to bed with a mosquito in the room. And I have a story to go along with that. I've been caregiving for my dad as well, and he's been having plumbing issues, and the water in the basement attracts mosquitoes. And while I slept, I woke up with like 12 mosquito bites. I need 12 mosquitoes. Every small deed counts. Just one call to a policymaker or one opportunity to speak out at a community forum, every small deed counts. Systemic racism must stop, and it will require one small act from each and every one of you. Thank you.